ADHD is a very common brain disorder in children, with about 6 million kids in the US being diagnosed. Many parents may not know much about the condition until their child is diagnosed, and the information they receive from doctors can be hard to understand or not specific to their child's needs. It's tempting to search for information online, but it's important to be cautious as not all sources are based on reliable science. There are many myths about ADHD on the internet, such as it not being a real medical condition, or that all children with ADHD are hyperactive, or that kids outgrow ADHD. However, major medical groups all recognize ADHD as a valid condition that should be treated. If you're feeling overwhelmed by a new ADHD diagnosis, this guide can help you understand the basics about ADHD and its treatments, and how to separate facts from fiction. Learning about ADHD can help you advocate for your child and find the right treatment for them. ADHD is a brain disorder that usually appears in childhood and is a real medical condition that affects how a child's mind develops and works. Kids with ADHD often struggle with executive function, which is the skills that help them plan, organize, and control their behaviors and emotions. However, ADHD can look different in each child. Some kids have trouble with focus and attention, while others can't sit still or control their impulses. Some kids experience both hyperactivity and inattention. These symptoms can make it difficult for children to succeed in school, make friends, and have a happy home life. Doctors are still learning about the causes of ADHD and the best ways to treat it. They do know that ADHD tends to run in families, so if your child has ADHD, it's possible that you or the other parent may have it too. Other factors that could trigger ADHD include head injury, early birth, low birth weight, exposure to alcohol or tobacco smoke in the womb, and chemical or lead exposure in early childhood. Diagnosing ADHD requires a team effort. A mental health professional will assess your child based on feedback from you, your child's doctor, teachers, and other caregivers. Your child will also undergo tests to measure their attention and other ADHD symptoms. The doctor may also ask you and your child's teachers to fill out forms like the Conners rating scales, Conners CBRS, or the Vanderbilt ADHD rating scales. These forms ask multiple-choice questions about social, emotional, behavioral, and academic issues in kids aged 6 to 18. Some research suggests that in the future, doctors might be able to diagnose ADHD by measuring brainwaves. However, currently available EEG devices, including the FDA-approved Neuropsychiatric EEG-based assessment aid, NEBA, are still not very accurate and are best used to help with a traditional diagnosis. Treatment for ADHD usually involves a combination of therapy and medication. Medicines called psychostimulants can help reduce hyperactivity and other symptoms, while behavioral therapy can encourage self-control, impulse control, and organization. It's also important for children with ADHD to engage in regular exercise and limit screen time, especially fast-paced media like video games. Parent coaching and school support are also crucial for managing ADHD. When dealing with a new diagnosis of ADHD, either for yourself or your child, it's important to educate yourself about the condition. But be cautious when researching online. If you come across articles or books claiming that ADHD is a controversy or a myth, it's important to know the truth behind these claims. Myth: kids can get ADHD from eating too much sugar or watching too much TV. Fact: there is no evidence that diet or TV habits cause ADHD. The same goes for vaccines, there is no link between vaccines and ADHD. Myth: preschoolers are too young to have ADHD. Fact: most kids with ADHD are diagnosed between ages 3 and 7. It's important to seek a diagnosis from a pediatrician or mental health professional who specializes in ADHD in children. Myth: children who can't focus are just lazy. Fact: ADHD is a real medical condition. Kids with ADHD have difficulty focusing due to differences in brain function, not because they are lazy. Myth: all kids with ADHD are hyperactive. Fact: kids with the inattentive type of ADHD may not display hyperactive symptoms, making it harder to diagnose. Myth: medicine can cure ADHD. Fact: there is no cure for ADHD, but medicine and therapy can help manage symptoms. Myth: kids will outgrow ADHD. Fact: While symptoms may improve over time, about 80% of children with ADHD will continue to have the condition as adults. When researching ADHD, it's important to use reliable sources to ensure the information you find is accurate. You can start by talking to your child's pediatrician, who may refer you to a child psychologist or psychiatrist for testing. These professionals can provide credible information about ADHD and recommend trustworthy places to learn more. Be cautious of websites that claim to have a cure for ADHD, as there is currently no cure for the condition. However, medication and therapy can help reduce its effects on your child's life. It's also important to avoid sources that suggest ADHD is not a real condition. For reliable information, websites from the government, national ADHD organizations, universities, and medical centers are usually the most accurate sources. Some good places to start your online search for ADHD information include American Academy of Pediatrics, Centers for Disease Control and Prevention, CDC. Children and Adults with Attention Deficit/Hyperactivity Disorder, CHADD. National Institute of Mental Health. In addition to online resources, consider joining a support group to learn more about ADHD. Your child's pediatrician or CHADD can help you find these groups. At a support group, you can connect with other parents of children with ADHD, who can share strategies that have worked for them. Many of them have valuable experience and expertise to share.